Now, if you're familiar with this, traditional occupational therapy requires a lot of repetitive movement. We've shown you the grand opening of the Knoxville Rehabilitation Hospital, but now we're taking a look at some of the high-tech machines that are improving the lives of stroke and brain injury patients. In this week's Health Watch, Tirsa Smith shows you a robotic machine helping patients in the recovery process.
It takes time to rehabilitate from a traumatic brain injury. It's intensive therapy with lots of repetitive movements to restore motor function. At Knoxville Rehabilitation Hospital, there is a machine that makes treatment more productive.
So what we're doing is just trying to do a lot of repetitions.
Occupational therapist Eric Greco is impressed with the success of the facility's bionic in-motion machine. It provides robotic-assisted shoulder and elbow therapy for those battling neurological conditions or injuries.
So it's just like going to the gym, you're doing, 3 sets of 10 or whatever it might be at the gym. Whereas the machine here, we can do, 200, 300, 400 repetitions within a 15, 20-minute treatment.
Renee Anderson is one of their patients who uses the bionic arm.
Coming to therapy is the best thing you can do if it's available to you.
She has a non-cancerous tumor. It has been a long, tough road to regaining her mobility after 3 brain surgeries.
I've never been to therapy before. No, my first one, I came out with no memory and hardly any mind and hardly any ability to write. I had to relearn everything after my first surgery. My second surgery went fine. It was a small one, and this third one has been a duper.
The in-motion arm and hand robotic device monitors the patient's movements during therapy and gently guides them through it.
And who says that recovery has to be boring? For the patients that use this machine, there are actually games set up on here. It still puts them on their path to recovery, but gives them a little bit of entertainment.
The first time it's kind of trial and error. You want to get them used to the machine, get them buying into what we're working on.
And once they do buy in,
they enjoy it. It's good because they can actually see the results. It'll show how much help they're needing, how much help the robot has to help. And then over time, the goal is to have where they're doing 100% of the action themselves.
For Health Watch, Tirsa Smith, WATE 6 on your side.
That is fascinating. Now, Knoxville Rehabilitation Hospital is one of few that has the technology you just saw here in Knoxville. It opened in June 2021. It has rehab programs for stroke, brain, and spinal cord injuries.